yourselves. We're going to ask for a roll call so we can move along. There's another committee meeting after hours.
Sure, Madam Chairwoman. Ms. McLaughlin?
Here.
Rosano? Here. Beston? Here. Larillier? Here. Platsky? Ricard?
Present.
Robinson?
Here.
Conway?
Here.
And Whalen.
I want to refocus.
You have a quorum.
Thank you very much. Can we get a motion to approve the previous meeting minutes?
Second.
Moved in by Beston and seconded by Rosano. All those in favor? Aye. Any opposed? None, thank you very much. So we'll go on to our order of business. We're going to go through items 1 through 6, and then, do I have to get a motion to this? Yes. Okay, and then we're going to ask for a motion later to group 7 through 14. So, but we're going to please, as the council to please.
Madam Chair, we can't hear a word you're saying.
Okay, and I think I'm yelling, but I will speak up. I'm not known for having a soft voice. But anyhow, what we're going to do, we're going to go through the items 1 through 6. And then we're going to call for a motion to group items 7 through 14. So that will expedite our meeting tonight. I'm not trying to rush anything. I'm just trying to, just for efficiency, we're going to go that way, okay? So at this point in time, we're going to go to item number 2, and council is now going to read the title.
Sure, Madam Chairwoman. Item 2 is authorizing an agreement with the New York State Office for the Aging regarding Title 3B Supportive Services Funding.
And
Commissioner Rattano is here.
Yes, thank you, Commissioner. If you'd like to share some comments.
Well, it's a same thing we do every year. It's a grant award, an amount of $308,000. And it's for the supportive services that we do for seniors, which is like legal aid, our social adult daycare, senior centers, caregivers. In home.
Does anybody have any additional questions about that?
I'll make a motion. Is Jim out there?
If not, can I get a motion? Motion by Beston, second by Ricard. All those in favor?
Aye.
Any opposed? Motion passes. Thank you very much. Item number 3.
Item 3 is authorizing an agreement with the New York State Office for the Aging regarding the Title 3C1 Congregate Meals Program.
So as you know, our award amount is $453,000, almost $454,000. We have 22 congregate meal sites throughout the county. We service a lot of people, so we're just asking to accept the money.
And I know that legislator Larilliard asked some questions about some of these, and I know we're getting that information in terms of volume, where the money
It went out.
Yes, so thank you.
So,
May I, Madam Chairwoman? I just want to thank you very much for providing those statistics. My concern is always that if we have a population of seniors that need assistance, I hope we're able to take care of them with the funding that we have. And
I
that's
sure
my
hope we are
reason
too.
for asking for that. So thank you so much.
And I think I say this to you all the time, the demand for our services keeps going up, but the money that comes from the money that's coming in from the state doesn't match it. We're never able to, that it always stays the same, but we do the best we can with what we have.
So thank you for that.
You're welcome, thank you.
good. Okay. Any other questions? Yes, Mr.
Can we
John.
ask for more?
I was about to. The question came up here, and I didn't read my mind. Can we ask for more money? And is there some way we either, as legislators,
Well, first
can we
of all,
help advocate?
For us in the counties, it's not RFP'd for us, and it's based on the census. So it's what your census is, depends on how much money we get.
Well, maybe they need to change the formula. I don't care what the census is. If the numbers are not meeting the need, because things have changed.
Yeah, well, you know what? New York City would have, New York City could rival us on that. I mean, they have such a big need, but everybody, they rely on the census.
We'll insert ourselves in the process somewhere along the way. I'm very serious about that. So we had a motion, it was second. We did not, we had motion by Mr. Beston, second by Ms. Larilliard, I think. And all those in favor?
Aye.
Any opposed? Thank you very much. The motion passes. Item number 4, is it?
Yes. Item 4 is authorizing an agreement with the New York State Office for the Aging regarding the Title III-C2 Home Delivered Meals Program.
Okay, our award amount again is $311,000. We service, we have, I think, 4 vendors that deliver our food. The demand continues to go up, and then it goes down because people come onto the program and then go off the program. It depends on why they're put on the program. But we're doing well. We don't have anybody waiting.
Is there any seasonal effect? Seasonal effect, like summer, do you get larger numbers, or winter, do you get more numbers?
That's a great question. I don't know the answer to, but I'm going to ask it. We really have to analyze that. I don't really know. I don't think so. I really don't think so. I think, people who are put on for a long term, it isn't going to change. If somebody comes out of the hospital and they need it for a short term, that could be any time. I think it remains the same, but it's a great question, and tomorrow we'll look at that because that's a great question.
Thank you. Do we have a vote on that? If there are no more questions, can I get a motion by Ricard, second by Beston? All those in favor?
Aye.
Any opposed? No, the motion carries. Thank you very much.
Item 5 is authorizing an agreement with the New York State Office for the Aging regarding the Title III-D Medication Management Program.
So we received $23,000 for that, $24,000, I guess, if you add up, and that's evidence-based health promotion. We really have 2 vendors that it goes to, one that does falls prevention, and the other one is Hope, Senior Hope, which deals with addiction. And it's not a great amount of money, but that's what we have.
Does anybody have any questions?
Would you note that I'm
Yes, ma'am, we did.
please?
I knew you had went out for a question.
Thank you.
Thank you. If there are no other questions, make it a motion. Motion by Beston, second by Lozano. All those in favor?
Aye.
Any opposed? Thank you very much. Now we'll move on to item number 6.
Item 6 is authorizing an agreement with the New York State Office for the Aging regarding the Title III-E Caregiver Support Program.
So our caregiver support program has been awarded $215,000. That funding source, is federal, and the county has a match, 25% match to that. The caregiver, we give money, we support community caregivers and the caregiver programs in Colony. Through Life Path is another one, and certainly DSS is also, and that includes respite care. Oh, Catholic Charities, yeah.
So are those the big ones, or are there others?
It's a Catholic Charities, Colony Senior Services, Colony Resource from the town of Colony, Community Caregivers, Life Path, and DSS. So the little PERS unit that you see seniors with, the personal, the button, that comes through that, and that comes through DSS.
Okay.
That's just an example. That's me.
Before we move on to the next group, this is, I hear Colony Services, I hear Catholic Charities, and I know that they are countywide. And Senior Services seems to be, again, concentrated, I see, in sort of outlying districts. I really would like to see evidence of where things are. You said we had 22 sites for congregate meals, for example. So for some of these other services, it really is, and Mr. Robinson asked this question a few months ago just about one particular program. But I'm concerned about I'm not saying the equitable distribution of all of these programs throughout the county, from the hill towns to downtown. And I don't know, I'm not well versed on that. What the people getting up in Bern or Altamont versus those that are in Colony versus those that are in the South End or Arbor Hill of Albany. I need to see that. If I could get a map or a pie chart or some type of histogram or something that shows me how these funds are distributed, that would be helpful to me. I'm not asking you for it right
We'll
now.
get a map for you.
Okay.
Yeah. I mean, we have to go where the need is.
No, absolutely.
You know, where money has to follow the need.
And
You know,
absolutely.
equitable doesn't work in this situation.
I'm not yes, it does, because I believe it does. I'm not talking about equal. I said equity. I'm not talking about equal, because I do understand you have to go where the need is. And if it's not getting where I see some need, why is that? Is it our outreach? Is it the people aren't coming to it? They don't know about it, and they don't even know to request it. So wherever, there could be many barriers that keep people from getting the information to get to the service. I don't care, and that could be anywhere. Like I said, from downtown to Bern to Altamont to any of the Claverack or any of these other little towns.
Well, you know, we have really great outreach. We do a lot of outreach programs all year long. Then vendors that we have do their own outreach that bring people in. And I have to tell you honestly, sitting here at 75 years old over the weekend, I want to tell you that I look to all of you to be that emissary that you also work to get the word out. Because you've chosen to be on this committee. So we like it when we hear from legislators who are out helping the constituents come to us. We really love that.
And that's my whole point, because if we're not doing our part, we want to help you by doing our part. Mr. Robinson.
Thank you, Madam Chair, for recognizing me. You made the statement that you have to go where the need at. How do you know what I'm saying, what type of yardstick that you have while you're identifying where the need at? Because in certain system tracks, it clearly states that some municipalities or some districts have more of a economic burden than the next. So how is your organization determining the need that you say you got to go where the need at? How you determine where's the need at? Your organization.
Yeah, we're collecting the data. And as a matter of fact, right now, we're doing an assessment throughout the county to get even more data than we have. And, you know, people come through New York Connects, and they get referred to us for services. Anybody who refers to us, I mean, we have to go through New York Connects first to get the people in the system. So, and that coupled with all the outreach that we do. And, you know, we could go out every day and do outreach and be on the street and hand things out, you know, and people have to recognize that they're in need also. You know, I mean, that's another thing. We have a case right now where we have to turn somebody who really needs help. You know, people are entitled to their own determination. Rule number 1 in social work. And I never took social work, but that's the rule. And so, you know, if you certainly have somebody who is in need and they need to come to our services, call us.
So you determine your need through New York Connect. So everything, all information and the data
Well,
that you
and we go,
receive.
we look to see where, in the congregate meals, you know, when we go to the congregate meal sites, and the people that are there, you know, and so they're taking one service. They may need 2 or 3 services down the. Well, you know that they might need 2 or 3 services down the line. So, you know, we look in a lot of places, but people have to say that they need it. You know, I mean, we just can't go down and say, we think you need the help.
No, thank you, and I think we will, you know, take all that under advisement, and if we identify our own individual constituents that need help, we need to make sure that they're getting access to the information, so.
Yeah, and you know, I mean, let me also tell you this, because they also need to be assessed. You know, an assessment needs to be part of that with the services that they're getting.
So I think once you give me that map, and I think we'll distribute it to everybody on the committee, not just the committee, but also to all of our legislators, because I would imagine it's not just the legislators that are on this committee that have needs in their districts, it's everywhere. So I think that would be some valuable information so that others who say, maybe, you know, I'm not doing the best job of getting this information out. And we want to help every legislator be as efficient and effective as they possibly can. So thank you for reiterating that, and we look forward to getting that additional information.
Well, and thank you for the referrals that you bring to us.
So can we get a motion to?
I would like to
Yes,
say happy belated birthday. I heard you say that. I did pick that up. So thank you. I make a motion to approve.
30 looks good on you.
So I make the motion for the agreement as presented.
Motion by Ricard, second by Beston. All those in favor? Any opposed? Thank you very much. Motion passes. Can we get a motion now to group items 7 through 14? Motion by Mr. Ricard that we group items 7 through 14, and can we get a second? Second by Ms. Larilliard. Am I saying that correct? Am I saying it correct? Larilliard.
Yes.
I'm leaving out a syllable, Larilliard. Okay, I'm gonna keep practicing. I don't like to mispronounce people's names, because I don't like to be called Caroline. My name is Carolyn. So, but anyhow, all those in favor? Any opposed? Thank you very much. Motion passes. Now we will ask the council to read the titles. 7 through 14.
I was there combined. 17 to 14.
Okay, well then, you can go ahead and speak. We're not going to read all the titles. If there's something that you'd like to
Oh, you
share.
grouped them all, okay, all right.
Yes, we grouped them all together so you can make a general statement.
Oh, all right, so the first one that you're going to see has got to do with access transportation that you are looking at. That, you know, helps people get to the pharmacy and to medical appointments. Let's see, what was the next one? CSC, all right, so that was for the elderly supportive services for the elderly. And let's see, the next one is wellness and nutrition, that we use that money for home delivered meals and transportation. And the next one is for ISIP services. So that's, you know, ISIP services are, you can't be on Medicaid to get them. There's a cost share involved with it. And it is a big amount of money that I think is a big amount.
1 million.
Yeah, 1 million, so, and that also runs through DSS. And I think not the last one. High cap, that'll be coming up now. That'll be the healthcare insurance that we actually contract that out to Statewide Senior Action Council, who handles all of our high cap and Medicare issues. That is the Congregate Services Initiative. No, that's a small one. What's the next one? Unmet need. Unmet need. I want to, the reason why I'm starring unmet need is because, as I told you about, we go by the census. We didn't think we were going to get unmet need money this year. I think I may have mentioned that way back. It looked like the governor was not putting that in to her budget. And then at the last minute, it did go into the budget, and we actually got more money than we got last year for unmet need. So that is great for us. It gives us the opportunity to do extra things, and so we're really excited about that.
Could you give an example of what an unmet need is? Is it just purely by volume? Or are there certain things that pop up that that seniors might be requesting at any given time that wasn't in your
We're allowed flexibility with that money, so where we need the money. So if we were running low in congregate meals, we were able to take that money so that because we see we have more people eating, the price has gone up, we've got, we need to help people out, and so we have that little cushion, I think $516,000 was pretty good this year. We got $400, I think, last year. But it's not chump change, it's a good cushion to have.
Go ahead, this was on.
Commissioner?
Yeah.
As far as the unmet needs, does it have to be a group of people who like the congregate meals? If you need more money for that group or a certain location, you can take the money. What if somebody needs a ramp? Are you able to use that money to purchase a ramp for that person?
We would be able to. Yep.
It's good to know.
And the last one is New York Connects, and you know that we contract with DSS to do New York Connects. They're the first place of entry, and this year it's $400,000, so it's an adequate amount.
So we keep a small portion.
Yeah, and that's true. We keep a very small portion for ourselves in aging, but most of it goes to DSS.
Does anyone have any other questions? If not, I just want to say thank you for being forthcoming and transparent in in answering the questions we've offered tonight. Thank you so much. And so we're going to ask for a motion to accept these, Ms. LaVilliard, second by Mr. Robinson. All those in favor? Thank you very much. No
Madam
opposed?
Chair, I'd like to take this moment to thank so many of you that are sitting around the table that sent me messages on the loss of my mother a few weeks ago or came to her services. I'm truly grateful. My brother Tony Catalfamo is also very grateful, and want to extend that thanks to all of you for remembering our family. Thank you.
Thank you. Thank you. And continued condolences. Can we get a motion to adjourn? Motion. Mr. Ricard and Mr. Veston, all those in favor? Aye. Aye. Thank you very much.